Fastray LC is a light-cured custom tray material. Supplied in pre-formed sheets, LC provides a firm and stable tray that is ready to use immediately after trimming and polishing. Benefits of Fastray LC include pre-formed sheets, no distortion, ready to use, may be used on patients allergic to monomer, odorless, material can be added at any curing stage, easy to drill and trim with a burr.
Hello, I'm Dr. Rick Bona for the Bosworth Company. Today we are going to talk about the construction of a custom tray for either denture impressions or custom trays for dental implants or for crown and bridge. Demonstration today will cover for a denture implant. The material we're going to use is Fastray LC, standing for light cure. We have our preliminary model. I like to soak it in warm water because I like to use a wax spacer on my denture impressions. Soak it in warm water, then with warm water I soften up pink base plate racks, the regular type, and start molding the warmed wax around the working model. After that is done, I keep forming it, trimming it, so I get a nice even layer, approximately 1 millimeter, of spacer upon the working model. At this point I chill it, it's now firm, and I design my tray. With the spacer I like to use stops. There's several ways to do the stops. And I like to just cut out little segments. And they pop out. Good. On the one side I have a little chip. I'm not worried about it. So the purpose of the stops is so that to prevent over compression of the impression material. So I have my little spacers. I spacer with the 3 stops, a tripod. And prior to placing on the tray material, we need to lubricate it. I like to use the Bosworth Mask silicone lubricant. I use a disposable brush. I then gently place a thin layer, not only on the wax, but where the plaster is, so nothing will stick to it. Go all the way to the vestibular areas. I may go back to the operatory just to use some air to thin it out. This is a nice project for the staff to do on downtime. And if you do not like to use a spacer, still lubricate the plaster model so that the tray material does not bond to any so-called discrepancies. Okay, I have it nicely lubricated. I now open up the Fastray LC. It comes in several colors. Because I like to use the pink wax spacer, I will use the blue trayaway material, Fastray material. Cover it back up. It is light sensitive. Snaps shut nicely. They got a nice little opening catch to open it again. Now once again, where we were worried about having the spacer even, for the strength of the tray we need to have this evenly. So I like to keep the so-called little mesh separator on it. And I like to start right near the posterior border. And then I like to go from the middle, gently press it, and then mold it onto the ridges. And if you're doing this over for a partial denture, you'll need an extra sheet to go over where there are teeth. I just keep pressing it, molding it nicely. I have no special lubrication on my hands, as with the commonly liquid powder that has to be mixed. There is no really foul smell. And now I could remove this, and you could see what a nice material this is, and I have it placed about everywhere I need. I'll go with some lab instruments to make sure I have it molded nicely into the vestibular areas. I then will gently go with the lab knife and trim off the excess. Okay, I'm very happy. It looks nice and clean. I could touch it. It doesn't smell foul. And now to place a handle for delivery of the tray for the impression. I'm able to mold it. Now the tray handle, you do not want to have it impinge on the patient's lips at all, because you want to get a nice impression of the vestibular area. So we'll just place this a little either at the level of the crest or perhaps a little back. I think I got too much there, so I'll just pinch it off. It's staying nicely to the model. And basically make a nice custom handle here where I could put an indent for my finger so I could deliver the tray nicely. So this is the tray. The tray is now placed in a light oven for curing. The length of time for the curing depends upon the light oven, whether it be a halogen or a fluorescent tube. So this time I'll take it to the light oven and cure it, and I'll be back. Okay, the tray is out of the light oven. Good here. It's very dense composite type of material. We gently remove it. It comes off nice and clean. And here's the wax layer inside. Two methods to remove the wax. Generally though, it comes out nicely because of the mask lubricant that was inside. At times we'll place it underneath cold water. It'll make the wax more brittle. This way it will pop out even cleaner. Depending on type of wax you use, you could hear this is hard wax. Sometimes the wax will stick inside and leave a film and hard to remove. That time, soap and water, or else like the Bosworth orange solvent, works beautifully to dissolve some of the wax to clean this off a little bit better. This is now done. I have a nice firm tray, the handle's strongly attached, and now we do adjustments, whether it be on the lathe or otherwise with a chair size or small handpiece. Take off all the sharp, rough edges so we don't cut or injure the patient. Clean it up. However, I like to use some relief. Certain areas of the mouth in which there may be flabby tissues, I do not want to overcompress, even though we had a spacer. I will then transfer to a round burr. And for the lab, I'll either mark or otherwise they know where I like to have a relief. You can see how hard this material is. And now I have some relief. As stated earlier, soap and water, ultrasonic cleaner, alcohol. We take off any film that's left, any wax that's left, and we go to the mouth. Now this was taken off a preliminary impression from a stock tray, so there may be some discrepancy still between the custom tray and in the mouth. We may be a little short on the posterior areas, or perhaps you'd like to have a more firm post-dam area. I use the Bosworth Alginate Super Gel to take my final denture impressions. It's water, it reacts nicely with the tissue, doesn't smell, and gives beautiful detail. Thank you.
For more information on Fastray LC, contact the Bosworth Company or your favorite distributor.